The third presentation is by Paul Revill from the Center for Health Economics, University of York, UK, and he's talking about a novel partnership for evidence generation and informing policy formulation on resource allocation and health. The Tanzila Onzi Health of All program. You are most welcome.
So I'm going to describe and talk about a new program, a new partnership, which has been developed out of what a number of people working within the research and policy fields within the region felt was a perceived need. And that need was that although health economics specifically as a discipline has lots to offer in informing and holding to account policy decisions, particularly in relation to resource allocation and healthcare organisation for countries within this region, the strengths of the field hadn't fully been able to affect policy as much as may have been the case due to a number of factors. And one of the perceptions was that health economists working in many places were too often standalone, either working within government structures, within ministries of health, and having the sense that the academic support was not fully available to them for their day-to-day operations, working with academic organisations and feeling that their research wasn't able to respond or to inform policy sufficiently, or working in a range of other organisations. So this programme, the Tanzila programme, started in Malawi as a partnership between the Centre for Health Economics in York, the Ministry of Health and the College of Medicine in Malawi, and has grown to include a number of institutions and organisations with the central aim of supporting capability building within health economics and related disciplines. So it's important for health economics to be interdisciplinary as a subject, and also supporting and enabling the use of research within policy making, so that it's responsive and it's informative. So it's you may see a number of presentations with similar slide sets on behalf of co-investigators in the Tanzila programme at this conference. And we're really here, all of us, to learn from experiences, and it's a novel partnership, and we feel that we still have a lot to learn in terms of how partnerships can be effective. But I just want to spend a little bit of time describing the organisation that we've put together within the programme. So the main aim for Tanzila, which means Health for All, is to ultimately help to improve population health and reduce health inequalities within Malawi, Uganda and the region. And crucially, this is done through the production of high quality research, plus enabling the use of that research in policy. And some objectives related to the programme are firstly to develop economic and relatedly epidemiological analyses to address health policy challenges. Secondly, and crucially, strengthening capacity, both policy and research capacity, to generate and use health economics. And thirdly, and also crucially, supporting partnerships and networks so research and policy can come together to effect change. So we've organised this programme around 5 key areas. 3 of those areas represent the 3 areas of academic research which co-investigators feel are most central to informing decisions as to resource allocation and healthcare organisation. The 2 other components relate to capability building and partnerships. So let me spend a little bit of time talking about the research areas. Those 3 areas are firstly epidemiology and modelling, disease modelling. Secondly, health economics. and thirdly, policy analysis and governance. So currently, most of the research is focused in Malawi, both with the Ministry of Health and the College of Medicine, but the hope is that research will also be undertaken here in Uganda and elsewhere within the region. Within the epidemiology and modelling field, the central aim is to do something that's never been done anywhere before, and that instead of doing analyses, cost effectiveness analyses, for instance, on an intervention basis, is actually to develop a model of Malawi's whole healthcare system. All diseases, all funding channels to inform how resources across the sector can be used most efficiently. That's something actually which has never been done in any country anywhere in the world. There's a presentation from Theme 1 by Wingston and Gamby at this conference. Secondly, within health economics, our aim is to be more responsive to immediate policy needs by combining applied analyses with development of methods. So yesterday, Pakwanja Tuya from the Ministry of Health presented on work to inform the resource allocation formula in Malawi across districts. There are also talks at this conference on contracting and purchasing arrangements and one by Mr. Katika on equity. The third theme is on policy and governance, and this is really addressing the fact that it's okay to have high quality research, but that's not developed in a way which understands the political dynamics and can inform decisions with knowledge of the financing structures that are in place within countries. It's unlikely to be fully utilised. So we have presentations on public financial management and politics in health by Alan Masosa and Tom Hart, which are contained within Theme 3. Okay, so research is one thing, but research for research's sake is never going to be sufficient. And to bring the strengths of research to bear to affect change, we need two other factors. So let me speak a little bit about these. Firstly, we need to enhance capability. And capability is not just capacity of individuals, capability also encompasses the strength of institutions to undertake analyses and use analyses. So the core objective is to support policy and research capability in Malawi, in Uganda and elsewhere through a range of measures: courses, bespoke training opportunities, mentoring, supervision. In Malawi, this has primarily taken the form of the establishment of a health economics research unit with formal ties to the Ministry of Health, but housed within the College of Medicine in Malawi. And there's a hope, and there's discussions taking place now, to similarly have a health economics research unit here within Uganda to meet similar purposes. And finally, I've hopefully emphasised the importance, and I suppose it's the topic of this whole conference, that for quality research to be undertaken, to be developed, needs to be done in partnership, and more so for it to be developed in a way which is ultimately useful to affect decisions, needs absolutely to be undertaken in partnership. So we have a whole component of work around the establishment of programme partnerships. These are at the national level. So in Malawi, this is housed within the Health Economics Unit within the College of Medicine. The hope is similarly that will be achieved in Uganda. And also a number of partners and funding for the programme, initial funding for the programme is from the UK. So we've also tried to organise institutions within the UK to support and engage in these efforts. Regionally and crucially, we fully respect and want to support the role of the East, Central and Southern African Health Community, EXA. So Mr. Katika will speak about one effort within this domain, and I suppose over the longer term, the hope is that this programme won't be called Tanzilionze, but will actually feed in and be owned and taken up by the mandated regional and national institutions. And finally, crucially, we're all aware that what decisions are taken place within budget allocation and healthcare organisation often depend upon what happens at an international level, particularly with WHO resolutions and WHO guidelines. It's appeared to many of us that often decisions are taken, for instance, in respect of WHO guidelines internationally, and then are asked to be implemented by a programme of research which highlights policy needs from the ground and where health can most effectively and efficiently be generated, recognising local constraints. That such activities can also act to inform better practice at the international level. So we've also been working with the World Health Organization and others in terms of how they use economics and modelling and policy analyses. So to summarise, the programme strives to support improvements in population health through supporting better informed evidence-based decision making. We aim to establish a collaborative and sustainable network of researchers skilled in epidemiological modelling, health economics and political economy, able to productively interact with policymakers. And we want our research to both combine development of methods, pushing the boundaries of our research fields, but ensuring we're doing that in a way which informs major health challenges, particularly within this region. So thank you.
Thank you.